The handouts or review materials must be treated with utmost confidentiality. It shall be the responsibility of the person whose name appears therein that the handouts or review materials are not photocopied or in any way reproduced, shared, or lent to any person or disposed in any manner. Any handouts or review materials found in the possession of another person whose name does not appear therein shall be prima facie evidence of violation of RA 8293. Top-notch review materials are updated every 6 months based on the current trends and feedback. Please buy all recommended review books and other materials.
Alright. Good morning, doctors, and welcome to your top-notch exam discussion. My name is Dr. Lagrosa, and let's start with biochemistry. Alright, so number 1, what is the bond formed between the pentose sugar and phosphoryl group of a nucleotide? Alright, and the correct answer is, it's actually the ester bond. Okay, ester bond. Let's look at the structure of a nucleotide. So, ang nucleotide, it has 3 parts. The base, okay, highlighted in green. The sugar, highlighted also. And 3 phosphates. Pwedeng dalawa, pwedeng isa. So, ito adenosine triphosphate, so 3 phosphate siya. Okay, between the base and the sugar is an N-glycosidic bond. So, between the base and the sugar is an N-glycosidic bond, which it makes sense because there's a nitrogen and there's a sugar. N-glycosidic. Nitrogen, sugar. And between the sugar and the phosphate is an ester bond. It's an ester bond. Then between the phosphates are anhydride bonds. Anhydride bonds. So remember, nucleotide, 3 parts, base, sugar, and phosphate. That is a must-know. Alright? Let's go to number 2. What type of collagen forms anchoring fibrils? Anchoring fibrils. And the correct answer is D, type 7 collagen. So this is a must-know. Always remember this table discussing the types of collagen. Type 1 is bone, skin, tendon, dentin, fascia, cornea, and late wound repair. 2 is cartilage, vitreous body, nucleus pulposus. 3 is reticulin. 4 is basement membrane or basal lamina. And 7 are anchoring fibrils. So there's this famous mnemonic. Always remember this. Type 1 is in bone and tendon. Type 2 is in cartilage. Type 3 has reticulin. And type 4 is under the floor. Type 4 on the 4, which is your basement. And type 7, tinuro na to sa inyo ni Dr. Rubio. 7, 7, 7, para siyang anchor. Alright? So, this is a must-know. Number 3. According to the 2015 Dietary Survey of the Food and Nutrition Research Institute, what is the typical Filipino diet? Typical Filipino diet. Kayo ba? Ano bang kadalasan kinakain nyo? And the correct answer is A, combination of fish, vegetable, and rice. So this chart is actually taken from that particular dietary survey conducted by the agency. And as you can see, pinakamarami yung rice and rice products. And then susunod yung vegetables, and then susunod yung fish and fish products. So basically, think, ano bang available sa atin? Of course, rice. Of course, vegetables. And we're an island nation, so fish. Alright, but medyo recall to. So I advise you be familiar with some community nutrition resources. So yung mga Comnut friends nyo, tanongin nyo na sila. Okay, 4. What cell plays a major role in linking the innate and adaptive immune responses of the body? So the correct answer is dendritic cells. Dendritic cells connect the innate and adaptive immune responses of the body. Let's look at this table differentiating innate versus adaptive immunity. So when it comes to specificity, innate is non-specific and adaptive is specific. And then when it comes to memory, innate has no memory while adaptive has long-term memory. And when it comes to adaptation, innate has no adaptation. Yung skin mo naman, skin lang yun forever. while yung adaptive has progressive adaptation. So yung T cells mo, they get better and better each time at recognizing pathogens. Alright. And when it comes to effectivity, innate is fast. Matic, may balat ka, merong barrier, di ba? But adaptive takes days. Kasi yung learning ng ating T cells, it requires time. Parang ikaw, it takes time to pass the boards. Kaya mo yan, Doc. Okay, let's look at the components of the innate immune system. So these include phagocytes, monocytes, macrophages, neutrophils, and NK cells. While the adaptive immune system includes lymphocytes, T and B cells, and plasma cells, and antigen-presenting cells or dendritic cells. So, you might be confused, macrophage versus dendritic cell, diba? Medyo similar sila, and that's right, they're both derived from the monocyte. But the difference is, the dendritic cell specifically does antigen presentation. So if you look at this diagram, yung macrophage, it points to cytotoxicity, fibrosis, and phagocytosis, cytokine production, and tissue surveillance. Pero yung dendritic cell at the bottom, antigen presentation and T cell activation specifically. So the best answer for this, so although macrophages and dendritic cells are both in the choices, the best answer would be the dendritic cell because it specifically presents antigens to T cells, therefore linking the innate and adaptive immune system. Okay, medyo tricky yun but just be mindful that dendritic cells specifically do antigen presentation. Okay, let's go to number 5. Which of the following statements is true about myoglobin? Okay, so let's look at the choices. A, myoglobin is composed of 4 polypeptides. That's false. It only has 1. Ano yung may 4? That's hemoglobin. And B, the oxygen myoglobin dissociation curve is sigmoidal. Sigmoidal ba? That pertains to hemoglobin. Ang myoglobin dissociation curve, it's hyperbolic. And C, myoglobin is mainly used for transportation of oxygen. No, that's hemoglobin. Myoglobin is for storage. So the correct answer is D, myoglobin can only bind 1 oxygen molecule, which makes sense. Kasi 1 polypeptide lang yung 1 polypeptide lang yung meron ng myoglobin. 1:1 lang, di ba? So let's look at this table comparing myoglobin versus hemoglobin. So in terms of structure, myoglobin isa lang yung polypeptide chain while hemoglobin has 4 polypeptides. O2 bound, 1:1, 1 for myoglobin, 4 for hemoglobin. When it comes to the O2 dissociation curve, hyperbolic ang myoglobin, ang hemoglobin sigmoidal. Main purpose ng myoglobin is for O2 storage while hemoglobin is for O2 transport. And where is it found? Myoglobin, heart and skeletal muscle, while hemoglobin is in RBCs. Allosteric effects are absent in myoglobin while present in hemoglobin. Here's a mnemonic. Myoglobin, myoglobin. Puro me, selfish. So it does not like to share O2. So, kanya lang yun. Storage lang niya yun. Hindi siya nagbibigay to other tissues. Okay, number 6. Which of the following substances directly inhibits the ATP synthase of the electron transport chain? Okay, let's look at the choices. Rotenone, complex 1, carbon monoxide, complex 4, 2,4-dinitrophenol is an uncoupler. While oligomycin, yan ang tamang sagot. Complex 5 inhibitor siya. Okay, let's discuss ETC inhibitors. So, ETC inhibitors bind to components of the electron transport chain and they prevent the passage of electrons. Kung hindi gumagalaw yung electrons, there is no electron gradient formed. Therefore, less oxygen consumption. Remember, oxygen is the final electron acceptor. So, kung walang electron na gumagalaw, wala ring tatanggapin yung oxygen. So, it's not consumed. And high intercellular NADH over NAD and FADH over FAD ratios. So, NADH and FADH2 accumulate because they cannot transfer electrons to the electron transport chain. And therefore, there is less ATP. Okay, let's look at the different complex inhibitors for complex 1. You have the barbiturates, pyridine A, amytal, and rotenone. For complex 2, you have malonate, carboxyl, and TTFA. For complex 3, you have antimycin A and dimercaprol. For complex 4, you have cyanide, carbon monoxide, sodium azide, hydrogen sulfide. Complex 5, which pertains to the question, it's ATP synthase, is oligomycin. So let's look at this mnemonic. Complex 1 inhibitors. Amy had 1 pair of Barbies. Amy for amytal, 1 for rotenone, rote1, pair for pyridine, and Barbies for barbiturates. For complex 4, mga ide, cyanide, carbon monoxide, sodium azide, hydrogen sulfide. So, let's discuss kasi medyo tricky. Ano ba ang ETC inhibitor versus uncoupler? So, ETC inhibitors prevent the passage of electrons, while ETC couplers increase the permeability of the inner mitochondrial membrane to protons. So, sa ETC inhibitor, yung movement tumigil. Sa ETC uncoupler, yung movement tuloy-tuloy lang pero walang gradient. So, therefore, sa ETC inhibitor, O2 consumption is low, protons cannot pass and combine with oxygen. Sa ETC uncoupler, O2 consumption is high. Protons keep on passing, pass, and combining with oxygen, but still no ATP is formed kasi walang gradient. Okay, let's go to number 7. Which of the following is true about Le Chatelier's principle? Okay, so the correct answer is D. A catalyst increases the rates of both forward and reverse reactions by the same amount. Let's look at the Le Chatelier's principle. It predicts the direction in which an equilibrium will move when there is a change in 1. Concentration, 2. Pressure, 3. Volume, and 4. Temperature. So let's look at this table. Responses of a chemical equilibrium to stressors. So if there is an increase in a concentration of a substance, it shifts away from the substance. Kung may decrease naman, shifts towards the substance. Increase in pressure shifts towards fewer moles of gas. Decrease in pressure shifts towards more moles of gas. Increase in temperature favors endothermic reaction. Decrease in temperature favors exothermic reaction. While, take note, this is very important, catalysts do not shift the equilibrium. So, catalysts, pareho lang yung equilibrium, pero it increases the rates of both forward and reverse reactions by the same amount. Let's discuss this mnemonic. Le Chatelier's principle, always think of balance. So, increase in temperature. So, ang daming temperature sa system, pababayaan mo lang ba yun? Hindi, gagamitin mo siya. So, you would consume the extra temperature in an endothermic reaction. Kung decrease in temperature, ang lamig, pababayaan mo lang bang malamig? Hindi, gagawa ka ng init. Produce temperature in an exothermic reaction. So, it's all about balance. Parang buhay lang. Alright, let's go to number 8. Which of the following omega fatty acids is mostly associated with decreased risk for thrombosis and cardiovascular disease? So, this is a recall question. It's the omega-3 series. Omega-3 series. So, how do you remember this? With this mnemonic, omega-3 is good for you. The OK hand sign. 3, OK. Omega-3 is good for you. Okay, number 9. What is the most abundant RNA in the body? Recall? It's the ribosomal RNA. So let's look at this summary table of the types of RNA. So mRNA, 5% lang siya. It has the least in amount but has the greatest variety in size and sequence. And it functions as the template for protein synthesis. rRNA, 80%. Rampant, and is a component of ribosomes. tRNA, 15%, functions as the carrier of amino acids to the ribosome for protein synthesis. Paano ko maalala? rRNA, rampant, most abundant. mRNA, multivariate. So, although onti siya, it has so many variations. So, marami siyang forms. Okay, number 10. What is the acceptable macronutrient distribution range for simple sugars? Again, this is a recall question. Maraming ganito sa board. Favorite ng BOM natin recently ang mga nutrition questions, including the percentages, recommended percentages. So, I suggest that you take some time to look at these. So, the correct answer is B, less than 10% of total calories. So, ano ba yung simple or added sugars? Sugars that are either added during food processing or packaging. So, syrup, honey, concentrated fruit, or vegetable juices, aka yung pampasarap. Okay, the recommended amount is less than 10% of AMDR, and it's associated with increased body weight, type 2 DM, and dental caries. Okay. Number 11. Which of the following statements is false about net protein utilization? False, half false. So the correct answer is D. Plant products are deemed to have a higher quality of proteins than animal products. So this is obviously false. Syempre, proteins, meat. So that would come from animal products. Let's discuss net protein utilization. It measures the protein quality by calculating the nitrogen used for tissue formation divided by the nitrogen ingested. It's a value from 0 to 1, with 1 being the protein source with high supply of essential amino acids. Let's summarize that in this table. So, protein digestibility corrected amino acid score. It talks about the protein quality based on the essential amino acid profile. How about biological value? So it's calculated by this formula, nitrogen used for tissue formation divided by nitrogen absorbed. While yung net protein utilization, almost the same as biological value, the formula is nitrogen used for tissue formation divided by the nitrogen ingested. While the protein efficiency ratio is the measurement of animal growth, particularly in rats. Okay, number 12. Which of the following vitamin toxicities can increase the risk of developing podagra? Okay, so let's look at the choices. Letter A. Pyridoxine toxicity usually causes neuropathy, while ascorbic acid toxicity usually causes GI upset. And vitamin A toxicity can cause pseudotumor cerebri, fractures, and it's teratogenic in pregnancy. So the correct answer would be niacin toxicity, also known as podagra. What's podagra? It's the painful first metatarsophalangeal joint. Okay. Paano natin maalala? Kasi ang niacin, very, very high yield yan eh. It can, deficiency can lead to pellagra, and toxicity can lead to podagra. But they sound so similar. Pellagra, podagra. Nakakalito. So, pellagra, may niacin levels, niacin deficiency. Podagra, nag-OD, overdose ako sa B3. So, podagra is toxicity, pellagra, is deficiency. Okay. Number 13, which of the following statements is false about muscle glycogen? Okay, the correct answer is letter D. Muscle glycogen mainly contributes to blood glucose levels. Okay, let's look at the difference between liver versus muscle glycogen. So, muscle glycogen, the total amount is higher, and the liver glycogen is lower. So, it makes sense because in your body, ano bang mas malaki, yung muscles mo or yung liver? Cumulatively ha. Di ba mas marami kang muscles kumpara sa liver? So, if you add the total amount of glycogen in your muscles, mas marami talaga yun than the liver. How about concentration? Muscle glycogen is lower, liver glycogen is higher. Kasi kahit maliit yung liver, it's packed, super packed with glycogen. How about the function? Muscle glycogen is for muscle use, selfish share. Liver glycogen is for systemic use, so liver likes to share. So, G6Pase is absent in muscle glycogen and present in liver glycogen. Okay. Muscle is makasarili, does not like to share glucose, while liver is a lover. So, lovers like to share glucose. Okay, di ba sweet ka pag may lover ka? O, di ba? Okay, number 14. What is the total amount of kilocalories found in a diet consisting of 1 gram of carbohydrates, 3 grams of fat, 4 grams of protein and 2 grams of alcohol. Sorry guys, may math. Ako din, hindi mahilig sa math. But let's try to calculate this. The correct answer is D, 61. Bakit 61? So remember, carbohydrates contain 4 calories per gram, protein 4 din, fat 9, alcohol 7. So dun sa problem, 1 gram ng carbohydrates, so 1 times 4 equals 4. 3 grams ng fat, 3 times 9, 27. Tapos 4 grams of protein, 4 times 4, 16. 2 grams of alcohol, 2 times 7, 14. And then you add them all up, 4, 27, 16, 14 equals 61, which is our correct answer. Okay. Number 15, which of the following metabolic pathway rate-limiting enzyme pairings is correctly matched? Okay, let's look at the correct answer. It's D, gluconeogenesis, 2-fructose 1,6-bisphosphatase. So, guys, recently, ang ating biochemistry exam, trend breaker, nasabi na ni Doc Broly na nagkakaroon na ulit ng clinical biochemistry. So, make sure to focus on both. Huwag niyong kaligtaan yung bawat handout. Kasi, we don't know what will come out. So, this is a very, very high-yield table of rate-limiting enzymes. I'll give you a few minutes to look at them. Okay. Alright. So, make sure to go through this table. Okay. Let's look at 16. A 35-year-old male patient developed signs and symptoms of hypoglycemia, vomiting, and jaundice. Prior to his current condition, it is noted that the patient had finished a jar of honey. Urine dipstick test revealed negativity for glucose. What is the most likely defective enzyme causing the condition of the patient? And the correct answer is A, aldolase B. Okay, so let's look at fructose intolerance. So essential fructosuria is because of a fructokinase deficiency, and it's typically benign and asymptomatic. While hereditary fructose intolerance is due to an aldolase B deficiency. So medyo mas toxic to dahil may profound hypoglycemia, jaundice, hemorrhage, hepatomegaly, liver failure, and sometimes even death. And often, symptoms appear after weaning from milk. So, in our case, medyo toxic Balikan natin. O, tingnan mo. Hypoglycemia, vomiting, jaundice. So, pipili ka, is this essential fructosuria or hereditary fructose intolerance? Considering na toxic, this is probably hereditary fructose intolerance. Therefore, the correct answer is aldolase B. Okay, number 17, activation of fatty acids via formation of acyl coenzyme A mainly occurs in this compartment of the cell, and the correct answer is letter D, cytosol. Let's look at the steps of beta oxidation. So step 1, fatty acyl synthetase activates the fatty acid in the cytosol, which pertains to our question. Pag activated na yung fatty acid, carnitine palmitoyl transferase transferase nga activated fatty acids from the cytosol to the mitochondria. And then, nagsastart na yung repetitive steps natin na OHOT, oxidation, hydration, oxidation, and thiolysis. Okay. Let's look at number 18. What is the correct order of the repetitive 4-step process of fatty acid synthesis? Fatty acid synthesis, not beta oxidation. So, the correct answer is C, condensation reduction, dehydration reduction, CRDR. Okay, let's compare and contrast lipogenesis and beta oxidation. Medyo confusing kasi, di ba? Lipogenesis, you're making fatty acids. Beta oxidation, you're burning the fat. So the rate-limiting enzyme of lipogenesis is acetyl-CoA carboxylase, while in beta oxidation, it's carnitine palmitoyl transferase. Subcellular location, lipogenesis happens in the cytosol, while beta oxidation happens in the mitochondria. And the transport mechanism used in lipogenesis is the citrate shuttle, while in beta oxidation, it's the carnitine shuttle. Okay, for the repetitive steps of lipogenesis, it's CRDR, condensation, reduction, dehydration, reduction. For beta oxidation, it's OHOT, oxidation, hydration, oxidation, and thiolysis. And then for lipogenesis, the product is palmitate. And in beta oxidation, syempre you're breaking down fat, so yung mga products mo is acetyl-CoA, NADH, FADH2. While in lipogenesis, it's activated by citrate and inhibited by long-chain fatty acyl-CoA. Beta oxidation is inhibited by malonyl-CoA. Hormonal state favoring pathway. For lipogenesis, syempre you're making fat, so you want the anabolic hormone insulin. While in beta oxidation, you're burning, you're destroying. So you want the catabolic hormone glucagon. Okay. So how do you remember that? So remember this mnemonic, when you burn fat, you become oh so hot. So you burn fat for beta oxidation, oh so hot, oh hot. Oxidation, hydration, oxidation, dialysis. Number 19. Which of the following enzymes is responsible for catalyzing the formation of a phosphodiester bond within a strand of double-stranded DNA to join Okazaki fragments during DNA replication? So ano daw yung nag-join ng Okazaki fragments? And the answer is B, DNA ligase. So let's look at this photo of DNA replication. Simplified na ito. But basically, the strands are synthesized in opposite directions. The first one is the leading strand, continuous siya, while the lagging strand is synthesized discontinuously. So here are the key enzymes of DNA replication summarized in a table. Helicase unwinds the strands. SSB proteins stabilizes separated strands. DNA topoisomerase relaxes the supercoils. Primase lays down RNA primers. Primase. DNA pol 3 elongates new DNA strand. DNA pol 1 replaces RNA primers with DNA. And ligase, which pertains to our question kanina, seals nicks between Okazaki fragments. Okay, this is a must know. Last na guys, which of the following substances is or are required for the hydroxylation of proline and lysine in collagen synthesis? Ferric iron, vitamin C, or oxygen. So which is the correct answer? It's 2 and 3. So you need vitamin C and oxygen for collagen synthesis. Let's look at the hydroxylation of proline. So vitamin C converts ferric to ferrous iron, and ferrous iron and O2 are cofactors in hydroxylation. So you need vitamin C, oxygen, and ferrous iron, not ferric iron. Okay?
So, hello everyone, Dr. Tagoran here. So, let's proceed, no? Anatomy and histology na tayo. So, question number 1, which of the following does not differentiate, no? The jejunum from the ileum. The correct answer here is letter A, because numerous arterial arcades are associated with the ileum, not the jejunum. Okay? So, here is a table listing down the differences ng jejunum tsaka ileum. So, when I draw the abdominal wall, no, or cavity, I like to draw it parang piatos, no, with the umbilicus in the center. So these are the costal margins kasi. And this is the inguinal ligaments. So divide the abdominal cavity like that. So the jejunum is located up here, no? It's in the upper part of the peritoneal cavity, usually in the left upper quadrant, whereas the ileum is over here. So right lower quadrant and the pelvis, and the false pelvis, okay? So all of these pertain, no, to the walls of the jejunum versus ileum. And ito naman is the mesentery and the vasculature. Okay, so differences. So the jejunum is generally thicker, has thicker walls, has more prominent plaques circularis, and is more vascular and redder. Yung ileum naman, mas maliit, mas manipis, and is pinker, paler siya, kasi hindi siya ganun ka-vascular. In contrast sa mesentery, so mas mataba yung mesentery distally. There's more mesenteric fat, and there's Peyer's patches in the ileum. So in terms of vasculature naman, so I like to remember it this way. So again, here are just illustrations differentiating the jejunum from the ileum. So I like to write the jejunum this way. So malaking J with a malaking letter M also. Whereas the ileum, so parang small letter I naman and a small letter M. So the first two differentiate the jejunum and the ileum in terms of the wall. So, bigger, thicker yung jejunum and has more prominent plaques circularis. So, yung ileum naman mas manipis, less vascular, mas maputla. Okay? So, yung ito naman, yung dalawang M, it differentiates in terms of the vasculature. So, as you can see here, the jejunum has longer vasa recta and less yung arterial arcades. So longer yung vasa recta sa jejunum. Whereas ileum, so maraming small letter M na nakapatong, no? So shorter yung vasa recta, pero mas numerous yung arterial arcades. So that's how I like to remember them. And then last, you can't spell lechon without LE. So lechon, mas mataba yung mesentery sa ileum. Okay? So that's how I like to remember them. So proceed tayo to the next question. So esophageal opening, what level and what does it also transmit? So we know, di ba, I ate 10 eggs at 12. So it's 10 thoracic vertebrae. So tatlo yung thoracic vertebrae na choices. The correct answer here is naturally letter A. So let's discuss. So again, I ate 10 eggs at 12. Walang sawang mnemonic na yan since time immemorial. So esophageal opening, again, I ate 10 eggs, T10. And it transmits the esophagus along with the two vagal nerves. So these vagal nerves become the anterior and posterior vagal trunks once they pierce through in the abdomen. So aside from the esophagus and vagus nerves, it also transmits the esophageal branches of the left gastric vessels. Okay? So other choices din kanina also mentioned azygous vein and the thoracic duct. Those are actually transmitted by the aortic hiatus at the level of T12. So in thoracic duct and azygous vein, they're at T12, okay? Whereas the caval opening, and important to note, is that it's the only one within the central tendon of the diaphragm. So it transmits both the IVC and the right phrenic nerve, okay? So remember, aside from I ate 10 eggs at 12, also note what other structures are being transmitted, okay? So this figure just illustrates it better. So again, note, diba, sa central tendon, isa lang is the caval opening. So that's it for the esophageal, for the diaphragmatic opening. Sige. So next question tayo. Which is true about the thyroid and parathyroid? Correct answer is only letter C. So they share the same blood supply and lymph drainage. So the parathyroid glands are actually yellowish to yellowish brown. They're not brownish red. The thyroid does not originate from the third pharyngeal pouch. It's actually an endodermal diverticulum or outpouching from the endoderm. Okay. So here's another table that summarizes elegantly the differences. So again, the parathyroids are yellowish-brown. The one that's brownish-red is the thyroid gland. And important to note, lumalabas din yung figures or numbers minsan sa boards. 20 grams yung normal weight ng thyroid gland natin. So parathyroid, around the thyroid, is located on the posterior surface of the thyroid gland. And again, in terms of embryologic origin, the thyroid is from a diverticulum or outpouching of the endoderm. Whereas the third pharyngeal pouch, so medyo counterintuitive to, no? So the third gives off the inferior, whereas the fourth gives the superior. So parang baliktad siya, no? So hindi ibig sabihin na third superior, okay? It's the third gives rise to the inferior and the fourth gives rise to the superior parathyroid glands. And as you can see from the vasculature, so they have similar na arterial, venous, and lymphatic supply. Okay? So again, here's just an illustration. So the parathyroids are located posteriorly, no? So as you can see, it's sa ating thyroid gland. Okay? And also just another quick concept, no? Lumalabas din kasi ito minsan sa boards, yung accompanying nerves ng thyroid vessels. So superior thyroid artery, it's accompanied by the external branch of the superior laryngeal. There's a sub-branch of the superior thyroid artery, the superior laryngeal. It is accompanied then by the internal branch of the superior laryngeal. Whereas the inferior thyroid artery is accompanied by the RLN, or the recurrent laryngeal nerve. And important to note, there's only a middle thyroid vein, but there is no middle thyroid artery. And special to, minsan, may mga thyroid ya, ima artery yung ibang tao. Okay? So review that na lang din sa inyong handout. So high yield din yung table na to. Okay, proceeding. Which of the following is not true difference about the main bronchi? Correct answer is the left main bronchus gives off a superior lobal bronchus before entering the hilum. Kasi it's actually the right, not the left. Okay? So again, the right principal main stem bronchus gives off a eparterial branch before it enters the hilum. Whereas the left naman, it's only after it enters the hilum, dun siya mag-divide. So as you can see here, no? So it gives off this superior lobar bronchus before it enters the hilum. And also note is that it is eparterial. Eparterial meaning above the pulmonary artery. It's the only eparterial bronchus. The rest of the bronchi in both the left and the rest of the right are all hyparterial. So they're below the pulmonary trunk. I mean the pulmonary artery. Okay. Sige. So here's another table differentiating the two. So I like to use a mnemonic. The right main stem bronchus is a wide SUV like the Everest. This is not sponsored, okay? So AA, wide SUV like the Everest. So AA, it runs under the arch of the aorta. Okay? Sige. So it runs under the arch of the aorta. The right SUV is, the right bronchus is wider, it's shorter, and more vertical ang kanyang course. And since it's more vertical, it's more prone to aspiration. Okay? Under the arch of the azygos pala, sorry, forgive me for that. Under the arch of the azygos, not arch of the aorta. Okay? And again, it gives off an eparterial branch before it enters the hilum. So eparterial above the pulmonary artery and before the hilum. So again, right bronchus is a wide SUV like the Everest. Okay? Sige. So next question. Blood supply to the fundus of the stomach is from the splenic artery. Okay? So the stomach, all of its blood supply being a foregut derivative comes from the celiac trunk. So there are sub-branches lang of the celiac trunk to specific areas. So for the lesser curvature of the stomach, the blood vessels are called gastric arteries. For the greater curvature of the stomach, it's called your gastroepiploic arteries. And for the fundus, which is in the question, no, it's the short gastric arteries, which are sub-branches of the splenic artery. Okay? So for the left gastric artery, it's one of the 3 direct branches of the celiac trunk. So the right naman is a branch of your common hepatic. For the gastroepiploic, the left is a branch of the splenic, whereas the right is a branch of the gastroduodenal. Mga sub-branches ng celiac artery. Okay? So there are 3 anterior visceral branches from the abdominal aorta. The celiac artery supplies your foregut derivatives. So from the esophagus until your D2 or second part of their duodenum. So esophagus to D2. Your SMA or superior mesenteric artery is for your midgut derivatives. So from D2 until middle of your transverse colon. And the inferior mesenteric artery is for your hindgut derivatives. It's for the transverse colon and beyond. Okay? Hanggang before the end of the anal cavity. Okay? So yun, there are 3 initial branches, the left gastric, the splenic, and the common hepatic artery. And it gives also many sub-branches. Okay? So next question tayo. The only movable portion of the duodenum is the first part of the duodenum. So D1, or the first part of the duodenum, there's called a duodenal cap or ampulla. It's the first 1 to 2 cm, and it's mobile because it still has a mesentery. So the rest of the duodenum is already retroperitoneal, and it's fixed to the posterior abdominal wall. So hindi na siya masyadong nagagalaw. Okay? So important also is to know the levels of the duodenum. So from L1 to L3 siya. So if you draw it, it starts from the right first. So from the pylorus, it gives off D1, which is the superior part, and then D2, which is the descending part. So important here sa D2 is that this is where the bile duct and the main pancreatic duct secrete their secretions into the GI tract at the ampulla of Vater on the major duodenal papilla. Okay? And then the inferior, or D3, is horizontal, so it goes across, no, to the left side, and then L2 is ascending. D4 is ascending, going to L2 level. Okay? So kahit pa paano, letter C naman yan. And the duodenum is intimately related to the pancreas. Okay? Sige. So next, number 7, which structure passes through both the greater and lesser sciatic foramina? So there's only one answer here, and that's the nerve to the obturator internus. So the greater sciatic foramen provides exit from the pelvis into the gluteal region, and eventually, yung ibang structures dyan pupunta sa leg. For example, here is the sciatic nerve, posterior cutaneous nerve of the thigh, superior and inferior gluteal nerves and arteries, and the quadratus femoris. So all of them from the pelvis lalabas towards the gluteal or eventually towards the leg. And the piriformis is an important landmark in the gluteal region. Bakit? Because there are only 2 structures that are superior to the piriformis. That's the superior gluteal nerve and the superior gluteal arteries and veins. The rest are all below the piriformis. Next is the lesser sciatic foramen. So it's an entrance into the perineum from the gluteal region. So yung tatlong structures na to that both enter and exit through the greater sciatic and lesser sciatic foramen, para silang nag-U-turn, no? So from the pelvis to the gluteal area via the greater sciatic foramen. Tapos mag-U-turn sila through the lesser sciatic foramen into the perineum. So tatlong structures yun. That's the nerve to the obturator internus kasi it's from the lumbosacral plexus. The pudendal nerve and the internal pudendal artery and vein kasi this is the vasculature of most of the perineum. Most of the structures in the perineum. Okay? Tapos ang unique is si tendon of the obturator internus. Siya lang kasi yung nanggaling sa lesser foramen, yung dumaloy sa lesser sciatic foramen only. So, galing na siya sa gluteus itself, tapos pupunta lang siya sa perineum. Okay? So, those are the differences of those structures. And again, ito lang ulit yung sinasabi kong U-turn. So, from the pelvis sa loob, lalabas to the greater sciatic foramen, ganon. And then, papasok ulit, mag-U-turn through the lesser sciatic foramen into the perineum. Okay? Sige. Next, which is not a structure in the anterior wall of the tympanic cavity. The correct answer is the internal jugular vein. So 3 of these structures are in the anterior wall. So the carotid artery, the auditory tube, and the tensor tympani. The internal jugular vein actually forms underneath, no, sa floor siya, sa jugular fossa. Okay? So you can think of the tympanic cavity as a 6-sided box, no? So this is a figure from Moore. So tinanggal yung anterior wall, no? So yung mga structures ng carotid artery, auditory tube, and tensor tympani, tinanggal na. So superior or the roof is the tegmen tympani, and it separates the middle ear cavity from the brain or the middle cranial fossa. So this part is lateral. So lateral to the middle ear will be the external ear. And what separates the external from the middle ear is your tympanic membrane or your eardrum. Okay? And then sa medial naman, what's sa loob ng middle ear, yung mas loob is the inner ear, of course. And what separates the middle from the inner ear is your promontory and your oval window. Sa posterior naman are your mastoid air cells. And yung adductus, yun yung parang canal or opening into the adductus. Okay? And the floor is your jugular fossa, which is separates the middle ear cavity from the internal jugular vein. Tapos yung anterior, again, is the carotid. Okay? See, next question. What is the visual field defect when there's a lesion in the inferior portion of the left optic radiation? So inferior left optic radiation, that's your right superior homonymous quadrantanosia. Sige, so let's discuss the various visual field defects. So, start muna tayo. So the optic chiasm is a landmark, no, when discussing visual field defects. So anything before the optic chiasm, so for example, optic nerve, dito yung lesion that will result in monocular blindness. So only one eye is affected, okay? Anything below or beyond the optic chiasm will result in something that's contralateral, okay? Contralateral and homonymous. So opposite and the same retinal fields yung affected. So for example, if the left is optic radiation is affected, the right visual fields are affected, okay? And then peculiar sa optic chiasm is it's bitemporal hemianopsia, okay? So the outer fields of vision are lost with if there's a lesion in the optic chiasm, okay? Tapos ito yung nakaka-confuse yung difference na inferior from superior na optic radiation. So, Mayer's loop is the eponym for the inferior or temporal optic radiation. So, a quadrant lang yung affected sa kanila. Okay? Tapos pag sa occipital lobe ka na, there's always macular sparing. Bakit may macular sparing? Kasi iba yung blood supply ng sa macula natin. Okay? Sige. So, how I remember the difference ng parietal and temporal optic radiations is through this mnemonic, no? So, Tuguegarao City is up above, whereas Pagadian City is down below. So, Tuguegarao or temporal results in above, no? So, superior ang quadrantanopsia natin. Whereas pagadian C, T, parietal, pagadian P, inferior naman or down below yung affected. So, that's the mnemonic I use para relatable siya sa Philippines. Pero may iba din, so choose your own poison na lang. They use the mnemonic PITS. So, parietal inferior, temporal superior. Okay? So, choose your poison na lang. Okay? Sige. So, next question tayo. Question number 10. Oops. Okay. So, which is true about sex differences of the pelvis between the male and female? So, the false pelvis is shallow in females and deep in males. Okay? So the false pelvis is separated from the true pelvis at the level of the pelvic inlet. Okay, so this level, that's what separates the false pelvis. It's up above, versus the true pelvis, which is down below. And in females, ano yung purpose ng pelvis nila? It's mainly for childbirth, for reproduction, or sa obstetrics, basically. So to accommodate the baby, the true pelvis of the females has to be wider. It has to be, the pelvic outlet has to be larger, and the ischial spines should not be convergent on each other. So the females, yung below, the area below is more important. Kaya shallow na lang yung false pelvis nila kasi it also wants to accommodate the growing fetus. Whereas in males, the pelvis is thicker, the bone itself is thicker to accommodate for greater weight, usually among men. And kasi wala namang masyadong structure sa baba, the false pelvis is the one that's larger. Mas cup-shaped siya to accommodate other structures sa taas. Okay? So yun yung differences ng dalawa. Okay? So next question tayo. Insertion ng levatores costarum is the rib below. So this is a hard question, but I'll help you analyze it. Kasi kahit ako that hindi familiar sa levatores costarum, but we can analyze the function of the muscle based on its name. Okay? So anyway, the levatores costarum, its origin is the tips of the transverse processes, and then it inserts into the rib below. So levatores costarum, levatores, it elevates something, no? So levatores is elevates. And then costarum, di ba, costal margin, mga ganun, it pertains to the ribs. So it elevates the ribs, and it's actually one of the accessory muscles of inspiration. So if it elevates the ribs, so paano dapat yung action niya to elevate the ribs? So kung ito yung rib, kailangan yung pull ng muscle is from, parang pag ganun, it's from the top, no? So para mangyari yun, it has to originate from something above, going to a rib below, so that it elevates that rib. So that's how I would analyze it if I'm not familiar with the origin insertion of a muscle. Okay? So true enough, ganun nga yung insertion ng so to elevate the rib, it inserts to the rib below. Okay? So next question tayo. Which of the following layers is not present in the hair shaft? It's your root. Bakit? So your hair shaft, it's the part of the hair extending beyond the skin. So yun yung nakikita nating buhok, yun yung hair shaft. Whereas the root is what is embedded within the skin. Okay? It's what is embedded. So syempre, by the definitions pa lang, hindi pwedeng kasama ng hair shaft yung hair root. Kasi yung isa embedded, yung isa projects beyond the skin. Okay? And true enough, this figure is from Wheaters, no? So extending beyond the skin, hair shaft, hair root, embedded. And there are three concentric histologic layers. So outermost is the cuticle. The thick middle portion is the cortex. And the medulla is the core of any hair. So, para siyang ganyan. So first, this is the medulla. Then this is the cortex. And last is the cuticle. Okay? Next, what's the approximate weight of the pineal gland? Correct answer is 0.1 grams. Sige. So the pineal gland is also your epiphysis cerebri. It is located in the roof of the third ventricle and it secretes melatonin. Whereas your pituitary gland is also known as your hypophysis cerebri. It is the master endocrine gland and is located within the sella turcica of the sphenoid bone. Okay? So this was taught to me by my teachers nung first year med pa lang ako, and it has stuck with me ever since until now, no? So sabi ng teacher ko, the pituitary, think of it na parang pituitary, may paracetamol ka sa utak mo. Ganun lang siya, kasing laki lang siya ng paracetamol. So it's only 500 milligrams. So pituitary, paracetamol, 500 milligrams. Kasi ito yung pineal gland. So may number 1 siya, no? Pineal. Tapos pine, mo siyang tunog siya ng pine tree. Di ba yung pine tree? it's matangkad and thin. So parang number 1 din siya. So that's how I remembered it. Pineal gland, 1.1 milligrams. Your paracetamol is 0.5 grams. Okay? 0.1 grams, 0.5 grams. So I hope that also helps you. Kasi ako, it stuck with me ever since first year med. Okay? Next. 14th question. So patient with cavernous sinus thrombosis after periorbital cellulitis, what's the anatomical basis for it? It's because the facial vein is connected to the ophthalmic vein, which drains into the cavernous sinus. Okay, so cavernous sinus thrombosis is a bacterial infection, usually due to skin infections of the face. No, so if you remember your danger triangle of your face from the apex of the nose until their upper lip, so that's your danger triangle of the face. And the anatomic basis for that is because the facial veins drain into the cavernous sinus through the superior ophthalmic vein. So pwedeng kumalat yung infection sa face into the cavernous sinus through these ophthalmic veins. Okay? Sige. So again, more info lang sa cavernous sinus. Again, the anterior communication is the basis for your cavernous sinus thrombosis, but it also drains posteriorly to larger venous sinuses of the brain like the transverse and sigmoid sinuses and the petrosal sinuses. So highly board testable concept din yung contents ng cavernous sinus. So there's only 2 structures that travel within the cavernous sinus. That's your internal carotid artery and your 6th cranial nerve. The rest, parang nakikisabit na lang sila sa lateral walls ng cavernous sinus. CN3, 4, and V1 and V2. Kaya inisip ko parang jeep yung cavernous sinus. So 6C ka na sa loob, so CN6 and I ka sa loob. And 6C ka na sa loob, kaya sumasabit na lang, sa gilid na lang ang CN3 to V1 and V2. Okay, so I hope that also helps you remember the contents of the cavernous sinus. Okay, so next, chunks of the brachial plexus are located in the occipital triangle. Okay, so this is lifted from your handout, no? Yung diagram to draw the triangles of the neck. So again, the neck is a forest, sabi ng mga anatomists. So it's best talaga na you know how to draw the triangles of the neck. So 4 borders, the midline, the clavicle, the traps, and the mandible, and important muscles of the sternocleidomastoid, the digastrix, and the omohyoid. Okay, so anyways, focus on the occipital triangle. It's one of the sub-triangles of the posterior triangle. And important anatomical structures running within it are the CN11. It's a landmark, so it divides the posterior triangle accordingly. And important sa question natin is the 3 trunks of the brachial plexus. And then as well as posterior branches of the cervical plexus. So let's focus naman on the brachial plexus. And it's the major innervation to the upper extremities. And it passes through the neck, sa cervix, axilla, and eventually into the arms. Okay? So I like to divide the brachial plexus this way. So it depends naman sa mga med schools, but in our med school, what we use is rotunda cubao. So roots, trunks, divisions, cords, and branches. So the roots emerge, important na landmark is between the anterior and middle scalene. So ito yung anterior and middle scalene, kunwari, nag-emerge yung 5 trunks from there. Okay? 5 roots. And then the 3 trunks are located, as mentioned in the question, the occipital triangle of the neck. Doon sila bumababa hanggang sa axilla. And pag nasa cords level ka na, or some divisions also, that's already accessible through the axilla. And the 3 cords are named in relation to the second part of the axillary artery. So may lateral, medial, and posterior. Depende siya kung saan sila in relation to the axillary artery. And the 5 main terminal branches are the musculocutaneous, axillary, radial, median, and ulnar nerve. Okay? So that was the brachial plexus in a nutshell. All right. Next question tayo, sternal angle of Louis. What structures run at the level of this? It's only letter C, the junction of the aortic arch and the descending aorta. Okay, bakit? So this mnemonic has been with me since first year med school and it has never failed me. Basta sternal angle of Louis yung pinag-uusapan. So, rat plant yung original pero dinagdagan ko maging rat plant. So first, R, rib number 2 and the second costal cartilage. So the sternal angle of Louis kasi is in the junction ng manubrium sa sternal body. And if you feel it, that's around rib number 2. And then sa question natin, this is the arch of the aorta, where it starts and ends. So By extension, if that's where the arch of the aorta starts and ends, it's where the ascending aorta ends and where the descending aorta begins. Okay? Kasi tuloy-tuloy na structures lang naman yung ascending arch and descending aorta. So the T is a tracheal bifurcation and where the thoracic duct empties into the left subclavian. It's also where the pulmonary trunk bifurcates into the left and right pulmonary arteries. It's where the ligamentum arteriosum is located. Kaya dyan din nag-loop yung left recurrent laryngeal nerve. It's where the azygos vein drains into the SVC. It's where you find the cardiac autonomic plexuses. And yung important here is what level yung sternal angle of Lewy. It's at the T4 to T5 intervertebral disc. Okay? And it's a marker that separates the superior from the inferior mediastinum. So I hope this table, the rat plant table, also helps you when you study the structures in the sternal angle of Lewy. Okay? Sige, proceed tayo. Last few questions. Which is synonymous with the epicardium of the heart? That's your visceral serous pericardium. So the pericardium of the heart is unique in that it's a double-walled and a fibroserous membrane, which encloses the heart and the proximal great vessels. So most superficial is the fibrous pericardium. It is continuous with the diaphragm central tendon inferiorly. So it's fibrous. Wala siyang sinisikrit, matigas siya. And the next is the serous pericardium, which has two sublayers, the parietal and the visceral. So yung visceral, it's immediately surrounding or enclosing the heart. Kaya it's sobrang similar to the epicardium kasi it's reflected onto the external heart, okay? And then the parietal layer is composed of mesothelial cells that secretes fluid. Kaya in between the parietal and visceral layers, there's a capillary layer of fluids called within the pericardial cavity, okay? So again, FP, fibrous pericardium, serous pericardium has a parietal and visceral layer, and there is fluid in between, which is the parietal cavity containing pericardial fluid. Okay? Okay, next question. Number 38. What divides the liver into two true lobes? True functional lobes. Huh? So the correct answer here is letter C. The line drawn from the gallbladder into the IVC, which is also called Cantley's line. Okay? So there are two structures that divides the liver, no? So first is let's discuss muna the falciform ligament. So although it's kita siya agad, it's only an anatomic boundary. So it results in two unequal liver lobes, okay? So hindi sila functionally independent. Kasi yung functionally independent lobes is divided by the Cantley's line, which is from the gallbladder to the IVC. So bakit sila functionally independent na segments or lobes? Kasi they have their own branches ng hepatic artery, portal vein, and hepatic bile ducts, okay? Sige. So how I like to draw it is first, if you flip mo yung liver, so parang ito yung view when you do an exploratory laparotomy, if you've done it in surgery. So you see the inferior surface of the liver. So again, it doesn't have to be perfect. I'm not an artist myself, but I like to draw it this way. So ito yung inferior ng liver. And then I like to draw three circles, which are all blood vessels, and then one oblong. So the oblong, of course, is your gallbladder. So yung kalinya ng gallbladder is your inferior vena cava. So kalinya ng gallbladder, yung inferior vena cava. This will be your ligamentum teres or your round ligament of the liver. And then this is your ligamentum venosum. So yung LV is the remnant of your ductus venosus that shunts blood from the umbilical vein to the IVC directly. Okay? Tapos yung ligamentum teres is the remnant of your umbilical vein. Okay? And your round ligament is located in the free edge. So yung dulong-dulong part ng falciform ligament. Kaya usually ito yung parang falciform ligament line ko sa illustration ko. Okay? So this is Cantley's line. This is where your falciform ligament is located. And then in between, para ma-complete yung letter H, is your porta hepatis. So yung three structures na where they enter, no? Yung hepatic portal vein, yung hepatic artery, and your bile ducts. So I just make a letter H. So all of this will be your right liver lobe, and this one is your left lobe. So this is actually your caudate lobe of the liver. This will be your quadrate lobe of the liver, or your segment 4B. Okay? So that's how I like to draw it. Parang siyang letter H. So again, gallbladder to to IVC, ligamentum venosum to ligamentum teres. And then letter H, that's where your portal triad enters. Okay, so important is the cantley line. Okay, this is your quadrate lobe, this is your caudate lobe. Okay, caudate. So hope that helps you. So it doesn't have to be magandang drawing, basta naiintindihan. Okay, next, which cell secretes catecholamines in the adrenals? It's your chromaffin cells. So these three are all layers of your adrenal cortex. And then the chromaffin cells and ganglion cells are cells of your medulla naman. Okay. So proceeding, so histological layers of the adrenals. So the GFR, no, the three zones, salt, sugar, sex, patamis daw ng patamis. Okay? So this is zona glomerulosa dapat. So it secretes mineralocorticoids like your aldosterone, which is in charge of salt and water homeostasis. Okay? Next is your zona fasciculata. So it secretes naman cortisol. So glucocorticoids in charge of your metabolism, which includes that counter-regulatory hormone. So sugars, basically. And then last are is your zona reticulata, which secretes your weak sex steroid hormones, like your DEAs. Okay? So, di ba? Salt, sugar, sex, patamis ng patamis habang bumababa. Okay? And then your chromaffin cells, these secretes your epinephrine and your norepinephrine. Mainly epinephrine sa ating adrenal glands. Okay? So GFR, salt, sugar, sex, patamis ng patamis. That's how it's taught to me to remember those structures. Okay? Last question, medyo brute anatomy ito na memorization. So origin, superior ramus of the pubis, insertion, linea aspera of the femur. That's your pectineus. Okay? So basically, I'll just enumerate my important things to know. So your sartorius, its origin is the ascis, so don't forget that. And it inserts into the pes anserinus, so pyramidial in the tibia. So your pes anserinus has three muscles, or your sargent, diba? SGT. So that's your sartorius, your gracilis, and your semitendinosus. Okay? And then the iliopsoas is the strongest hip flexor. So these two muscles combine kasi they have a common insertion point. Okay, and then your rectus femoris naman, what's cool about it is because it crosses the hip, no? It originates more superiorly in the anterior inferior iliac spine into the quadriceps tendon, dito siya nag-insert, is the only part of the quadriceps that acts on the thigh. It also flexes the hip. Okay, whereas in vastus intermedius, medialis, and lateralis kasi, they don't cross the hip, therefore they don't act on the hip. Okay, so that was anatomy. I hope you learned one thing or two today. Okay, next. Alright, next subject tayo, micropara naman, no? Sige, so first question. So these are microbial peptides activating a large fraction of T cells with a massive release of cytokines. Those are your super antigens. So super antigens, yung unique sa kanila, how they can cross polyclonal activation of T cells that they skip normal processing by antigen processing cells or presenting cells. They directly bind to T cell receptors. Through polyclonal activation, there's massive release of cytokines, resulting in the life-threatening autoimmune response. Okay, so as you can see, most of your super antigens are produced by your staph. No, so enterotoxin, TSST1, exfoliative toxin, and meriding strep pyogenes. So exotoxins are any secreted polypeptides. They usually have an AB subunit structure, A for the active site and B for the binding subunit. So there are various mechanisms, including one of them is ADP ribosylation. So examples of ADP ribosylators are the toxin of C. diphtheriae, the exotoxin A of P. aeruginosa. The picolinic acid naman, it's a component of your endospores, and it's the critical element that allows for spore dehydration. So pag dehydrated yung spore, it results in prolonged survival and resistance to environmental influences. Examples of spores are seen in Bacillus and Clostridium na bacteria. Okay? Next question tayo. So we have gram-positive cocci, alpha-hemolytic, bile-insoluble, and optochain resistant. The organism is probably Strep viridans. Okay? So viridans strep is a gram-positive cocci and it's in chains. So as with other streptococci, it's catalase negative. Alpha-hemolytic means that it does partial hemolysis. Okay, there's green color when cultured on blood agar. It's bile-insoluble and it's optochin resistant. So again, yung important mnemonic sa gram-positive algorithm is your overpass. Okay, so optochin, viridans is resistant, and your pneumoniae is sensitive. Okay? Natural habitat niya is in the oropharynx. Kaya during dental procedures, it may enter the bloodstream. Kaya it's actually one of the more common causes of your subacute bacterial endocarditis. In fact, S. sanguis is the most common cause of subacute and native valve endocarditis. Okay? And the glycocalyx mediates its adhesion to the heart valves. Okay? So again, yung three important mnemonics sa gram-positive algorithm, it's your sa staph, no? So staph is catalase positive, and if it's coagulase positive, that's staph aureus. However, it's coagulase negative, you use the no stress mnemonic. So novobiocin, so saprophyticus is resistant, and epidermidis is sensitive. Okay? Tapos na-discuss na natin yung overpass kanina. So viridans resistant, pneumoniae is sensitive to optochin. And also sa pneumoniae, it's encapsulated. Kaya there's also a positive Quellong reaction. Okay? And then the last is for beta hemolytic strep. So we have the mnemonic BBRAS. So for group B strep, but they are bacitracin resistant. And for group A strep, like strep pyogenes, they are bacitracin sensitive. Okay? So yun yung three important mnemonics na alam na dapat natin ngayon. Okay? So next, mechanism of action ng V. cholera toxin, that's your increase in cyclic AMP. So Vibrio is a comma-shaped gram-negative rod, and yung importance na there's a characteristic shooting star motility. It's only found in humans and is transmitted via a fecal-oral route. So its enterotoxin is what causes its massive secretory diarrhea. So it acts by ADP ribosylation. So kaya constitutively activated yung adenylate cyclase, resulting in increased cyclic AMP. So mag-open yung mga chloride channels, and where chloride goes, para equal pa rin yung na zero yung charge, sodium follows. And where sodium goes, water also follows. Kaya there's massive secretory diarrhea. Kaya yung buzzword niya rin is your rice water stools, di ba? Sige. So here are other mechanism of action ng mga exotoxins natin. And as you can see, maraming bacteria that use the cyclic AMP pathway. So that includes your Vibrio cholera, the heat label toxin of your ETEC or enterotoxic E. coli, as well as your anthrax and your pertussis. Okay? So kindly read up on this table. This is very high yield. Maraming pwedeng kuning tanong dito. Okay? Sige, next, 38-year-old male IV drug user with infective endocarditis, gram-positive in clusters naman. So that's Staphylococcus, di ba? And there's resistance to methicillin. So Staphylococcus na may methicillin resistance, so you can think of MRSA. What gene is responsible for that? That's your MECA gene, okay? MECA gene. So the gene is your MECA, and then the protein that the gene encodes is your PBP2A protein. Okay? So wag i-confuse ha. So the gene, pag gene yung tanong, MECA. Pag protein, PBP2A. Okay? So Staph aureus, again, gram-positive cocci in clusters. So it has the aureus kasi yung pag kinulture mo siya, it results in yellow or golden colonies. So again, Staphylococcus siya kasi catalase positive, and it's coagulase positive kaya Staph aureus. Natural habitat is in humans, and transmission is contact with humans. And it's the most common cause of acute endocarditis. So it's a very virulent organism, kaya siya acute endocarditis, especially in IV drug users. Okay? So there are various variance factors, but we'll concentrate on antimicrobial resistance. So MRSA, or methicillin-resistant Staph aureus, is because of a MECA gene. There is resulting in an altered PBP2A protein. So iba yung gene sa protein. So yung PBP2A has reduced binding affinity sa methicillin and its family. Kaya siya resistant. There's also vancomycin-resistant strep, and this usually obtains the VAN-A gene through horizontal gene transfer from enterococci. And ito naman yung mechanism of resistance niya. Okay? Sige. So next, so keywords here, there's burns, nosocomial infection kasi second week na siya admitted. And there's gram-negative, oxidase-positive, non-lactose fermenting bacilli with a sweet odor. All of those point towards Pseudomonas aeruginosa. Okay? So Pseudomonas is a gram-negative, and take notes in an obligate aerobe. It's oxidase positive also. So as an obligate aerobe, its natural habitats are in environmental water sources. So usually nasa surface sila kasi they need the oxygen. And what's unique sa kanya is that it has a blue-green fluorescing pigment called pyocyanin that gives its characteristic color. And it also has a characteristic color na sweet or grape-like odor. Yun yung mga description sa kanya. So risk factors, again, basta pag burns, most likely, Pseudomonas yung pinapatanong. Pag nosocomial, so matagal na siyang admitted or naka-ventilator, most likely Pseudomonas din yan. And also there's the hot tub folliculitis kasi, again, environmental water sources ang kanyang natural habitats. Okay, so note lang din na if DM or other immunocompromised state can lead to malignant otitis externa, and for prolonged contact lens use can lead to severe keratitis. Okay? The next question, this is challenging, no? So, American tourist with prolonged fever on and off and recurrent. So you found large loosely coiled organisms. So which of the following is true? The correct answer is all of the above. So this question is tricky kasi there are many pwede mong isipin. So pwede mong isipin malaria, syphilis, pilitin mo kasi VDRL positive daw, penicillin drug of choice. Pero hindi siya pwedeng sa letter C kasi recurrent febrile episodes. So the organism responsible for this is actually your Borrelia recurrentis, or which causes your relapsing fever. So Borrelia is one of the spirochetes. So yung mga spirochetes mo includes your treponema causing syphilis, your leptospires then are also spirochetes, and this one Borrelia. So they're the largest and is the only one that can be seen with light microscopy. Kasi yung mga spirochetes, yung others like sa leptospirosis and syphilis, you need dark field microscopy. Okay? So Borrelia recurrentis is transmitted by the body louse pediculus humanus. Okay? Body louse. And yung clinical signs and symptoms niya is there's fever and chills that is recurrent or paulit-ulit, relapsing basically. So that's because bakit siya nag-recur is because of antigenic variation. So with antigenic variation, they escape the host immune response. Kaya pag nakita ulit siya ng host, the immune system thinks, oh, may bago na namang bacteria, so let's mount an immune response. Kaya ka magkaka-fever ulit. So diagnosis, kasi kita siya with light microscopy, is through blood smears. However, if you do serum tests, pwede siya mag-positive VDRL. Kaya pwede mo siyang ma-confuse talaga siya, syphilis. Okay? And here are the medications that can be used. So penicillin is still effective. Okay? So other body louse transmitted infections include epidemic typhus from Rickettsia prowazekii and Bartonella quintana, which may cause stench fever. Okay? So medyo challenging to, guys. So it's okay if you don't get it in your first try. But at least I hope you learned something new with this question. Okay? Next, MTB, tuberculosis, what's the culture medium of choice? That's your LJ medium. Okay? So alam na natin, kilala natin si MTB. So it's aerobic, acid-fast, but it's also weakly gram-positive. So why is it acid-fast? There's a high lipid content with the mycolic acid and other lipids. So it's stained using the Zeal-Nielsen technique or the Kinyon technique. So LJ medium, yung kanyang culture material, and its natural habitat is our lungs kasi aerobic siya, and is transmitted via respiratory droplets or aerosolized droplets as well. So the cord factor is the most important virulence factor of TB kasi it's the one that activates your macrophages and leading them to secrete TNF alpha. I mean, TNF alpha, which would activate your macrophages. Well, baliktad, sorry. Whereas in contrast, yung tuberculin surface protein natin, it's the basis of your TST or PPD because it triggers cell-mediated immunity and delayed hypersensitivity, or yung type 4 na reaction natin. Kaya natin malalaman na may TB infection ng isang tao. Okay? So here's a table of your important culture media. So again, si MTB, dito siya. I'll also take note of important ones that you should know. So H-flu, no? So chocolate agar plus factor 10 and factor 5. Okay? So si N-gonorrhea, if sa unsterile sites, you want to selectively dapat yung medium. Kaya to isolate N-gonorrhea, so selective siya dapat. So use Thera Martin agar kasi it has additional antibiotics in VCN natin. Okay? And then E. coli is your EMB agar. It results in the classic green metallic sheen, di ba, when it's cultured. L. interrogans is the EMJH or Fletcher medium. Pertussis, Bordetella pertussis, so Bordet, Ganjo, and Regan low, na cultured medium. And M. pneumoniae is the Eton agar. We'll discuss that later. And lastly, siguro is Salmonella, no? So XLD or pwede rin SSA. Okay? So, yan. Next tayo. So, ito na, si Mycoplasma pneumoniae. So, which is not true. Not true ang penicillins are the drug of choice. So, Mycoplasma pneumoniae are the smallest free-living organisms. So, they're very small that they cannot be seen on gram stain. So, hindi rin sila seen on gram stain kasi wala silang cell wall. So, yung dyes natin, walang kakapitan. What's another unique thing about it is that it has sterols in its cell membrane. So it's cultured, again, as I mentioned earlier, on Eton agar. So it has additional components for nutrition and penicillin para selective lang siya sa Mycoplasma pneumoniae. And the buzzword here is there's fried egg appearance or a mulberry appearance of its colonies. Okay? So it's a common cause of atypical or walking pneumonia. So pneumonia pero hindi ganon kalala, basically. And may result in hemolysis because of cold agglutinins, which are autoantibodies against your RBCs. Okay? So penicillins and cephalosporins are inactive against them. So hindi effective yung penicillins and cephs. Bakit? Di ba penicillins and cephs, they're cell wall. Their mechanism of action involves the cell wall. Eh, wala namang cell wall talaga si Mycoplasma pneumoniae. Okay? Kaya yung drug of choice sa kanya, erythromycin and azithromycin. Okay? Sige. Next question. So 36 female with recurrent episodes of UTI, gross hematuria, staghorn calculi. So complicated UTI with nephrolithiasis. All of those are keywords for Proteus mirabilis. Okay? So another buzzword for Proteus is your swarming motility. Kaya pag kinulture mo sa ganyan yung mukha niya, para siyang nag-travel. Okay? And importantly, it's urease positive. So urease is an enzyme in the bacteria that hydrolyzes urea to become ammonia. And we know ammonia is basic, so it turns the urine alkaline. And this alkaline environment favors formation of your struvite stones, which are composed of your triple phosphate or magnesium ammonium phosphate. So same lang yan, different terms lang. And struvite stones are very notorious for causing your staghorn calculi. So yung staghorn calculi, parang ganito, they go around the shape ng renal pelvis and calyces natin. Kaya it can cause obstruction ng urine flow and can cause complicated UTI. Okay? And even AKI, post-obstructive. Okay? Sige. So next, Klebsiella granulomatis. What does it cause? It causes your donovanosis or granuloma inguinale. And the characteristic is beefy red ulcers with a velvety surface. Okay? So, K. granulomatis results in granuloma inguinale. So initially, it's papular, but it becomes ulcerative. And note, no, wala siyang regional lymphadenopathy. Okay? It has a beefy red appearance because it is highly vascular. So, kita niyo ba, pulang-pula siya. And because it's highly vascular, it has a tendency to bleed. And when these lesions ulcerate or bleed, it can result in stricture formation, which can mimic squamous cell carcinoma. So diagnosis is established via the Donovan bodies or the Gemsa smear of its exudate. So Donovan bodies, ito siya, intracellular coccobacilli within macrophages. Okay? So here just a table summarizing the differences ng mga genital tract infections with ulcerations. So yung pwede mo confuse na dalawa is chancre versus chancroid. So yung chancre is painless, non-tender of primary syphilis. Yung chancroid naman is painful and tender ulcers. Okay? And there's regional lymphadenopathy. Another key buzzword is school of fish appearance on microscopy. Okay? So, ang condyloma lata naman and condyloma acuminata pwedeng mag-confuse din. So, condyloma lata is the lesion in secondary syphilis. It's like a wart-like moist verrucous plaque. Okay? And acuminata, similar din, parang cauliflower-like lesions in the perineum, caused by HBV 6 and 11. And then we differentiate granuloma ingulane from lymphogranuloma venereum. Okay? So, walang regional lymphadenopathy sa K. granulomatis. But here, there are buboes. And actually, it's the more prominent feature in lymphogranuloma venereum. Okay? And it's caused by C. trachomatis, serovars L1 to L3. Okay? And it may cause then draining fistulas and sinuses. Pero meron siyang buboes. Okay? And HSV2 naman has multiple painful vesicles that may ulcerate. Okay? So yun yung some differences ng lesions that ulcerate in the genital tract. Okay? So question number 11. So 12-year-old boy, matagal nang dinadiarrhea, tapos may stool exam, quadrinucleated cysts with motile trophozoites with RBCs in the cytoplasm. So that's your hematophagus, no? So kumakain ng RBCs. So, which is true. So, ano pathogen na to? It's your Entamoeba histolytica. Kasi it's hematophagus already. So, correct answer is only letter C. So, deloxanide furoate for asymptomatic carriers. Okay? So, bakit? So, amoebiasis, pseudopod-forming non-flagellated protozoa. It's also transmitted fecal-oral route through contaminated food products, water, and unclean hands. So, you ingest your mature quadrinucleated cysts, that's your effective stage, and then it exists into trophozoites in the intestines. So again, keyword hematophagus kasi there are commensal entamoeba species that are not hematophagus and are not pathogenic, okay? Kasi commensal sila. And it's the trophozoites that reach in extra-intestinal sites, okay? So treatment, no? For asymptomatic cyst carriers, use your luminal amoebicides. So your DIP, di ba? Diloxanide, iodoquinol, and paromomycin. For the invasive na amoebiasis, you use your tissue amoebicides, mainly metronidazole. Okay? So sa amoebic colitis, it's usually narrow-necked, flask-shaped ulcers. So narrow siya. Parang nagtatunnel nga eh. Nagtatunnel, lateral burrowing. Yung wide neck naman, which was choice A in the choices, is seen in your balantidium coli. Okay? And your most common extraintestinal form is your liver abscess, not lungs. Okay? So, that's just the gist of your amoebiasis. Okay? Sige. So, let's proceed to the next question. So, a Maltese cross formation is pathognomonic, or the buzzword for Babesia microt. Okay? So, babesiosis is transmitted by the bite of your Ixodes ticks, usually is in a problem in Northeast United States. And pathognomonic is the Maltese cross. So, para siyang 4 ring-shaped trophozoites in a tetrad. Kaya siya parang cross. Okay? So, it can cause an influenza-like illness, hematosplenomegaly, hemolytic anemia, and is more severe in the elderly and those with asplenia. And treatment is atovaquone plus azithromycin if mild, and if moderate to severe, use quinidine plus clindamycin. Okay? But keyword, Maltese cross. Babesiosis, automatic na dapat yan. Okay? Sige, next slide. 25 female from Palawan with recurrent bouts of headache, chills, fever, flushing. Blood smear showed banana-shaped ring forms with ring-like structures and granulations. So banana-shaped ring-like structures then. So banana gametocytes is seen in Plasmodium falciparum. So this is malaria basically. Okay, so sa P. falciparum, ano yung structures na nakikita mo? It's your Maurer dots. Okay? Sige. So let's discuss. So malaria is the #1 parasitic killer. It's transmitted by the bite of the Anopheles mosquito. So the infective stage is your sporozoites, and it's endemic in the following areas in the Philippines. So gold standard pa rin, thin and thick blood smears. So thick smear to screen for the organisms, and thin smears to identify the species. Okay? So what's unique in malaria is that the sexual stages, the definitive host is the mosquito, whereas humans are only the intermediate host kasi we only have the asexual stages. Okay? So here are some differences ng so we'll just focus on falciparum. So it has no RBC preference naman and has the highest parasitemia and is the one that can cause cerebral malaria and has many drug resistance. Kaya diba in the Philippines, pag P. falciparum, we already use combination na like the artemether, artesunate, and those kinds of medications kasi chloroquine resistant na yung falciparum. So Vivax and Ovale naman, what's unique to them is that they are young naman na RBCs ang in-infect nila and they have a tendency for relapse kasi they have hypnozoites which are tissue, which are schizonts within the liver. Okay? And yung old RBCs naman is your P. malariae. Okay? So basically, yun yung gist niyan. And falciparum, yung trophocytes na small paired, whereas yung vivax and ovale, enlarged yung RBC and has large fine pigments called your Schaffner dots. Okay, ito naman yung Maurer dots. Ito is Schaffner. Okay? And yung gametocytes ng falciparum is unique kasi it's a banana shape or crescent shape. Yung the rest kasi round sila. Okay? So, yun yung some differences ng malaria. Okay? Sige. So, aralin nyo lang yung table na to. Screenshot if you want. And it's also in your handout as well. Okay? Sige. So, which medication is gametocidal? It's your Primaquine. Okay? So, again, this is just your life cycle of your malaria. And in terms of treatment, so there are blood schizontocytes. So, it tackles those within the RBCs. Tissue schizontocytes naman are for those in the liver. So, for those with hypnozoites, so radical cure is afforded by your Primaquine. Kasi this kills your hypnozoites. Okay? And your gametocytes is also Primaquine kasi it kills the gametocytes in the human blood. Sporontocytes are effective for the mosquitoes. Examples are progonil, and pyrimethamine. So again, example of blood schizontocyte, balikan lang natin, is your chloroquine, hydroxychloroquine, quinine. And if they're resistant, you can use yung mga sinabi ko kanina, artemether, artesunate, and artemisinin. Okay? Last 6 questions. So, coconut cake rectum, buzzword din yan for what organism? Is your Trichuris trichuria. Very good. So, Trichuris is also known as your whipworm, and it's transmitted fecal-orally through ingestion of its eggs. So, its infective stage is your embryonated eggs. And it's actually part of the unholy triad na hat, di ba? Hat. So, your hookworms, ascaris, and Trichuris. So, the adult worms of Trichuris reside in the large intestine. So, di ba yung mnemonic? Chase, Kashte. So, I like to use the Kashte na mnemonic kasi Kash, ito yung sa small intestines, whereas TE ang sa large intestines or the colon. So, TE will be Trichuris and Enterobius vermicularis. Okay? And it also has no lung migration phase. So, walang leafler syndrome sa Trichuris dapat. Okay? And the characteristic finding on fecalysis is your barrel or lemon or football-shaped eggs with prominent bipolar plugs. Okay? So it can cause dysentery, rectal prolapse, kasi inflamed yung mucosa ng rectum and colon. And it has a coconut cake rectum when on colonoscopy kasi you see the small white bodies of the adult worms dangling from a reddish inflamed mucosa. Okay? Kaya siya mukhang coconut. Okay. Next, last 5 questions. So, cigar-shaped yeast cells and asteroid bodies, these are buzzwords for which mycosis, that's your Sporothrix skinky. So, Sporotrichosis, it's a thermally dimorphic fungus living on vegetation. So, diba? Another buzzword sa kanya is your rose gardeners or horticulturists. So, pag na-prick sila ng thorns ng rose, doon na magkakaroon sila ng Sporotrichosis. So, ang histopathology, you see cigar-shaped yeasts or asteroid bodies. Okay? And from a small painless bump, pwede siya mag-ulcerate. And yung ano sa kanya is that it spreads via lymphatics. Kaya meron kang subcutaneous nodules. Okay? So just briefly going through the other endemic mycoses. So H. capsulatum, it hides in the macrophages. And it mimics TB kasi calcific yung lung disease niya. And may cause erythema nodosum as well. Okay? So, Coccidioides immitis, it's desert regions, no? So, mga arid regions of the United States. Keyword sa kanya, fair use, okay? And it can also resemble TB. So, blastomyces dermatitidis, so B, broad-based budding. And it results in varicose skin lesions pag skin yung affectation that resembles squamous cell cancer, okay? And Paracoccidioides, it's in the Central and Latin America. And yung keyword din sa kanya is a mariner's wheel. So it's like a man-hater disease kasi it results in painful ulcers in the men aged 30 to 50 years. Okay? Sige, next tayo. So, known case of AML, may necrotic lesion sa nose. So, mucormycosis, di ba? keywords din yan, black eschar sa ilong. So mucormycosis, what are the microscopic findings? That's your broad non-septate or sinusitic hyphae and right angle yung branching. So the mucors, fungi are saprophytic and angioinvasive mode. When you see angioinvasive, they have a propensity to invade blood vessels, okay, leading to tissue ischemia, infarction, and necrosis. Kaya ka nagkakaroon ng rhinoorbital cerebral infection with black eschar kasi necrotic yung material. And on microscopy, it's non-septate or sinusitic hyphae with right angle branching. In contrast sa aspergillus na septated and acute or dichotomous yung branching. So again, ito yung difference ng dalawa. This is mucor, so sinusitic, pseudohyphae branching at right angles. Septate hyphae naman yung aspergillosis. Okay? Last three questions. So the only virus with single-stranded DNA, that's your parvovirus. Okay? So the DNA viruses, their mnemonic is happy, no? So all DNA viruses are double-stranded except parvo. Kasi parvo has a linear single-stranded DNA. So the naked DNA viruses are your pap smear, pap. So papillomavirus, adenovirus, parvovirus, and polyomavirus. So yung dalawang H's mo are not naked, they are enveloped. And parvo has a tropism for erythroid precursors. Kaya pwede kang magkaroon ng erythema infectiosum, aplastic crisis, hydrops fetalis, and the like. Okay? So erythroid precursors yung target niya. Sige. So influenza, which structure is used to bind? So bind to the cell surface. That's your hemagglutinin. Okay? So binding in, hemagglutinin in, to bind in. Okay? Neuraminidase naman is for the release of your viral progeny. Okay? So again, influenza virus is part of Orthomyxoviridae. It's enveloped, negative sense, single-stranded RNA, and its genome is segmented. So pag sinabong segmented, there's an opportunity for genomic reassortment of influenza A viruses pag nasa same host sila. So it may be human, swine, or avian. Parang mixing host nila. So reassortment results in antigenic shifts. Whereas mutations results in antigenic drifts. So again, di ba? Sudden shift is deadlier than your gradual drifts. Okay? So again, there are two major antigens in the envelope. Hemagglutinin binds to cell surface receptor, whereas neuraminidase to make alase, it's to release your viral progeny. Okay? Sige. So, last question for microbio and para. So, which medication inhibits the release of viral progeny? Those are your neuraminidase inhibitors, which includes your oseltamivir. So there are two medications for influenza. So your neuraminidase inhibitors, usually this is the drug of choice for influenzas A and B. So it inhibits release of your progeny by inhibiting the neuraminidase. Whereas your uncoating inhibitors like amantadine inhibits early step replication by preventing uncoating. It's for influenza A only. Okay? So thank you for listening. That was for MicroPack.